They're going to be set at a certain FiO2, right here. That is set by you. What does the patient need? Does the patient need 30%, 50%, 40%, whatever? When setting them, you're going to have a large bore tubing coming off. The liter flow you're going to run them on, you need to see a good mist coming out of the tubing. There is no exact flow other than get a good mist on these. We all know what this is, right?
Regulator.
Regulator, there you go. Flow meter, right? 1 to 15. Bag mask valves.
Show how to check it again.
Want to put your hand over this like that. There you go.
And to check the inlet, you would make sure that the bag is filled, right?
Correct.
Okay.
This is large bore tubing or corrugated tubing. Aerosol mask for large bore tubing. What else we have? Here is your face tent, which you're going to run with a large volume nebulizer.
Sometimes have you use that one?
Sorry, what?
How many times have you used
You
that?
use that quite a bit. If you get somebody in with like, I'll use a big word for you, epistaxis, usually pack it up, a severe bloody nose. They'll pack their nose, and so you can't put them on any other real oxygen device. You know, like a cannula. You put them on a face tent because their nose is blocked with basically they put 2 big tampons up their nose, and that's really what it is. They just put these 2 big ass tampons up their nose. That's the best way I can tell you. Some more large volume nabs here. You can see Mr. Man with his face tent on. That's exactly how you put it on. Did a good job. Gonna come over here. You've got all your oxygen delivery devices, small volume nebulizers. They're gonna be run on 5 to 10 liters. These are what you're delivering your medication with. Trach mask. It's gonna be run with your large bore tubing. Somebody has a trach. A lot of times when we're talking about heat, you're going to use heat with a trach mask a lot of times. Another small volume neb, another mask. Here's an HME. Where's my other HME? Right down there. There's 2 more HMEs right there. Here's your Passover humidifier. Going to be used on a ventilator or CPAP, BiPAP machine. And what else can we go over here? Here's your wick humidifier right over here on the stand.
Nice job, Alfredo.
Thank you.
Now what we should go over for you guys is how to properly insert one of these. This is important. Let's do it over here.
Okay.
Okay. This is gonna be in a plastic bag. You do not want to touch this. This is all sterile. You're going to take your cover off of here, put the cover upside down on the table. What I like to do is, this is in a bag, I like to rip open the bottom of the bag, kind of pull it down the sheath a little bit, go like this, don't hit the sides of the bottle at all. Go in nice like that, and I keep pulling back the sheath, take the plastic off, and there you go. Really easy, simple to do, but it's a talent, believe it or not.
Must have been good at surgery.
I'm sorry?
Surgery.
Yeah.
Operation.
There you go.
Yeah, really, that's what it is. You don't want to touch that. And you always want to take your cap and put it upside down. You never want to put it down, because if you have to recap that bottle, there could be germs on that cap. That's the reason for that. And that's very easy and simple to do. Here's another style of one. This is the really common one that you're going to see is right here. And as you can see on here, it'll say, where am I here? You have 30%. It's telling you should run it on 5 to 9 liters. But so, like I said, you want to get a good mist. If you can run it on 5 to 9 liters and you don't have any mist coming out, crank that sucker up. Get a good mist coming out. Very easy, very simple. This hooks up to your flow meter, large bore tubing again. Your best friend is large bore tubing. Here's a bubble humidifier. You hardly will ever see these. The most common bubble humidifier are these right here. Every hospital uses the same exact one. You take this little nipple right here, twist that off. There's another one here, you twist that off. This goes on the flow meter. Your cannula hooks to that.
That's the bubble.
Bubble humidifier. It's another Passover type device. You'll see this. This is very common. Large volume nebulizer. You're going to use this. Like we were talking earlier, croup for a kid. Most common one you'll see is right here. Same color, exact. You're gonna take sterile water, you fill it up to this line, do not fill it over that line, because it will just pour water into the tube, something fierce, and you're gonna drown your patient. I've done it, trust me.
Is there a difference between, you said that's for children with croup, is there a difference between that one and,
No, you'll use this one a lot for that. In
Oh.
the emergency room, you'll see this, you'll use this a lot.
there's, I'm saying between the two that you, no, the one that you had, that you said is a
This is
normal
for a
one?
cannula.
Okay,
This
all
is
right,
only used with a nasal cannula.
all right.
It's the only thing you can hook onto that is a nasal cannula.
So you're gonna use that on a mask and a,
Yep,
okay,
yep, large bore tubing and a mask.
okay.
You do not put humidification on any of these devices like non-rebreather, partial non-rebreather. No humidification at all.
Because they're getting enough from the bag, right? It goes in,
No, because
no?
the bag will fill with water.
All right,
And
okay.
plus it's small tubing. Anything with small tubing like this, you can't humidify. Other than a nasal cannula. Because you're going to be filling this mask with water. It doesn't work. You'll see nurses do it all the time, but you'll see slowly why it doesn't work.
You're gonna tell them, what the hell are you doing?
Right. Trach mask, obviously, you gotta know. I don't know, what else can we go over? You have oxygen delivery devices on it, maybe medications, you guys are going over medications?
Yeah.
There might be medications on it, and I don't know if you were here when I told them, know your medications. That sheet he has in front of him right there, know that inside and out, left and right, up and down. Know your LABAs, your SABAs, your corticosteroids, know the brand name, know the generic name, know them inside and out, because before you go to clinical, you're going to have to take a test. And I believe you have to get an 80 or above to go on to clinical.
Okay.
You're going to have to know that. Very, very important. You know those medications. Because you're administering them, number one. You want to know what you're giving your patient. And a lot of old school therapists, like I said earlier, don't call Atrovan. They call it ipratropium. And you sit there all day and say, oh, good, get me some ipratropium. If you don't know what ipratropium is, you're going to go, gotta know it. You gotta be really quick with it. And that's about it.
Now the 80% test, is that